This is where I'm filming my main video, my laptop. I'm gonna do a complete room scan. Here's my supplies. Here's complete room scan. There's the other side. And once again, there's my laptop. I'm gonna go ahead and begin. I'm gonna go ahead and knock on door, close door, provide privacy. Hello, my name is Ruby and I'm gonna be your nurse today. I noticed in your chart that your doctor has ordered for me to place an indwelling catheter. Can I get your full name and date of birth, please? It's Betty Bennington on March 3rd, 1967. Okay, Betty, do you have any allergies? I'm gonna perform hand hygiene. No? Okay, I'm gonna go ahead and raise the bed to height level. So your doctor has ordered for me to place an indwelling catheter. It's gonna go through your urethra and up into your bladder. If at any point you do feel uncomfortable, please let me know and I will stop the procedure. I just would like to let you know that this is a sterile procedure, and if you can maintain as still as possible, just so we don't contaminate and risk any infection since I'm inserting a tube up into your bladder. I'm gonna go ahead and uncover you if that's okay, Betty. Okay, at this point, I would have placed a bath towel on my patient. I'm gonna go ahead and position her. I'm gonna go ahead and uncover you, Betty, okay? Okay. So at this point, I would perform hand hygiene again, put on clean gloves, I would have a separate kit to perform pericare. I would grab some clean cotton swabs and I would clean front to back, dispose, front to back in the middle, dispose, front to back on the side, dispose, and then with the clean wet washcloth, I would clean on the outside, front to back. I would switch the sides, front to back, making sure that I've gotten everything. I've cleaned it really good. So now I'm gonna dispose of my gloves. I'm gonna perform hand hygiene, and I'm gonna go ahead and perform my sterile field. So I'm gonna go ahead and open my package. This is gonna be my trash. This is trash. So first, I'm gonna open it away from my body using the 1-inch border. I'm gonna use a 1-inch border in the package. To open. Now this is sterile. I'm gonna go ahead and grab my gloves. I'm gonna go ahead and open them on the 1-inch border of the package. Making sure I don't touch the box because the box is sterile. At this point, it touched a little bit on the inside of the packaging of the box, so I wouldn't place anything here because it's sterile. It's not sterile anymore, but the inside of here is. So I'm gonna go ahead and put my gloves on. Being very careful, keeping them above waist level. Okay, now that I have one on, I'm going to place it inside the cuff. I'm going to go ahead and place my hand through, putting it in. I'm going to go ahead, I'm sterile now. So I'm going to go ahead and grab the paper. I'm going to bring it away from my box, bringing it above waist level. If at any point it drops below waist level, I would go ahead and begin once again, but I'm gonna go ahead and turn and place it. Being careful not to touch the patient's leg, because if I touch the patient's leg, I would have to begin once again. So now I'm gonna go ahead and do the same with the white paper, bringing it above waist level, away from my sterile field. I will turn, leaving it alone. Now, I'm gonna go ahead and prepare my supplies. So I'm gonna go ahead and place it in here. I would throw this away. I would go ahead and open this. Being careful not to touch anything. This is trash. At this point, I will place lube on the tip of my catheter. This is trash now. I would have opened this already. I'm gonna go ahead and place this in my okay. So now that I'm done, I would come and bring my box that's sterile, place it on my sterile field here in the middle, being careful not to touch the outside of the patient's leg. With my non-dominant hand, since I haven't touched anything, I'm gonna fix this really quick because okay. So with my non-dominant hand, I would go ahead and place my hand here, open the labia. I would grab a swab stick, sterile swab stick, clean from front to back, being careful not to contaminate. Front to back in the middle, not contaminate. Front to back on the other side, not contaminate. Holding the labia open, still I'm gonna dispose of this. I'm gonna go ahead and grab my catheter, being careful not to touch my non-sterile hand with my being careful not to touch my non-sterile hand. I will insert the catheter until I see urine come. Once I see a flash of urine, I would do about a 1 to 2 inches, inserting a little bit more. Once that's done, I will go ahead and inflate the bubble, and then with my sterile hand, I'm gonna go ahead and tug. If I feel resistance, I would go ahead and disconnect this. At this point, since the balloon has been inflated and I felt resistance, I can release my hand. I don't have to be sterile now. I can go ahead and remove my gloves, perform hand hygiene. I would attach and put on some new gloves. I would attach the catheter to the leg. I would put the bag below the level of the bladder. I would clean the perineal area once again if needed. Situate the patient once again, and at this point I am done with my video.